Did you know that Americans spend $28 trillion in healthcare, more than $8,500 per person, which is way more than any other country, but the US is still ranked near the bottom for infant mortality, life expectancy, and preventable mortality?
The current healthcare system in the United States is majorly flawed. The US spends so much money on healthcare, reaching $3.81 trillion dollars in 2019 and is projected to rise to $6.19 trillion dollars by 2028, way more than any country, yet health outcomes in the country are horrible. The United States spends around $765 billion dollars annually on things that don't make Americans any healthier. As an inefficient healthcare system in which hundreds of health insurance plans all charge different prices for the same surgeries and scans. After all, healthcare insurers aim for profit over quality. There needs to be a way to solve this issue.
In the current system, there's a lot of corruption. Americans pay double as much on prescription drugs compared to other developed countries. The spending in nearly 18% of our economy. Even with this, the US ranks near the bottom for infant mortality, life expectancy, and preventable mortality. This shows that even with the high amounts of healthcare spending, there's not good quality of care. Only 1.3% of revenue goes into profits. Instead, insurers sacrifice quality for profit. They pay their private stakeholders tons of money, and their private stakeholders use some of this money to lobby against changing the system.
Introducing Medicare for All.
So, what is Medicare for All, you may ask? Medicare for All is a single payer healthcare system where the insurance pays private firms to supply necessary treatment to patients. Medicare for All decreases MOOPs, or medical out of pocket expenses, including premiums. First is by value based pricing. In our Medicare for All, prices are set by the government via value based pricing. Value based pricing is the price setting of medical drugs based on the value of the product. Value based pricing allows governments to see how much the drug should be priced based on its quality. With VBP, pharmaceutical companies don't set prices for lower quality medical drugs. Second, a fund. The Medicare for All system would have a fund where people pay taxes to. The fund will give money to people on a monthly basis, and each person will use this money to pay for the medical expenses. People would pay a portion of their money into a small bank called their Medicare bank. This money and the fund's money are both used to pay medical expenses. The amount of money used from the Medicare bank will be based on their income. Third, taxes. People will pay a portion of their income as tax to the fund. The amount of tax they will pay depends on their income. This means that the rich will pay more taxes and the poor will pay fewer taxes.
So, how does our Medicare for All differentiate from the Medicare for All proposed by Congress members? The original Medicare for All proposed by Congress members in the US government is a single payer healthcare system which requires people to give taxes to the government in order to fund the program. It replaces private insurance as well as the current Medicare program. It eliminates premiums and the government implements value based pricing of pharmaceuticals. Our proposal includes some of the same policies, but it would implement a fund that allocates a certain amount of money to each person to be used to help them pay for their medical expenses.
The feasibility and economics of Medicare for All. We need Medicare for All to be implemented in a feasible way, in a way that does not sacrifice quality for increased quantity of people using it. People have to pay their health insurance to get their care. While they don't pay for it directly, the government pays for this health insurance through increasing taxes, whether income or sales. This means the amount of money needed would have to be raised by taxes. Estimates of the cost include around $32 trillion. However, the US spends $52 trillion in healthcare to its high costs. From the cost standpoint, Medicare for All will allow these $20 trillion that is spent on healthcare to spend on other items. From a quality standpoint, given that Medicare for All would decrease profit, you would think that would be decrease innovation. However, private insurers only contribute 2% of their revenue, whereas the NIH pays double that. On a quantity standpoint, the US healthcare is not bad because of a lack of quantity of resources, but rather a more costly resource. If you compare a country like Germany, whose people use more healthcare services, they still have a lower per capita amount of money spent on healthcare. Now onto the advantages. Value-based pricing is a key part of increasing healthcare access. Many people cannot afford healthcare because of its high prices. Around 87 million people are insured due to the high prices of healthcare. Insurance programs are continuing to rise every year, pushing more and more people into poverty. For example, in 2019, health insurance premiums rose 20%. However, with Medicare for All, Americans will pay 15% less in the insurance rate, 34% less in hospital prices, and 37% less in drug prices, to allow Americans to pay for their medical bills.
Medicare for All would decrease medical out of pocket expenses, or MOOPs, including premiums, which Americans have to pay. Many Americans spend too much of their income on MOOPs. However, Medicare for All would decrease medical out-of-pocket expenses, ensuring Americans won't spend too much money on it. This would increase health accessibility because Americans will have more money to pay for medical treatments.
The last reason why Medicare for All is good is because it increases innovation. In the current private healthcare system, companies take advantage of the American people. They make drugs and tell us they will innovate. However, they make copycat drugs or drugs that are similar to the earlier drugs, but they have made but they have few extra ingredients that might be better or worse. These monopolies increase the price of these drugs, exploiting customers. This makes them extra profit, but does not help innovation. Instead, with Medicare for All, a system of value-based pricing, these drugs are evaluated based on their quality and not based on the companies making extra profit off no innovation. This will allow poor people access drugs instead of just the rich.
Many people have pointed out supposed flaws at the proposal of Medicare for All.
Critics of Medicare for All point out that value-based pricing increases profit. There are two reasons why this is false. First, private insurers pay 40% more on average than hospital operating costs. Medicare for All raises reimbursement rate to 110% of Medicare for All levels, which approximate operating costs of hospitals. In 2000, Medicare reimbursements were sufficient to cover hospital operating expenses. Second, by reducing administrative costs. Hospitals create massive apparatuses for administrative and billing costs. Medicare for All solves it as there's only one payer. Administrative costs consumed more than 25% of total U.S. hospital spending. When countries use a Medicare for All system, their administrative costs halved. Critics continue that Medicare for All increases wait times. Instead, Medicare for All would help decrease wait times. Administrative costs burden hospitals as doctors spend 9 hours a day filling out administrative papers. However, with a single-payer healthcare system, with the lower administrative costs, it allows doctors to spend these 9 hours of time with patients. It would increase demand of doctors by $300 billion and increase supply by 2.3 million.
Critics also point out that it would decrease innovation through reducing profits. However, innovation does not rely on money or profits. Rather, it relies on access to info about certain diseases and the people who might be prone to it. Medicare for All would increase access to healthcare, meaning medical providers would receive more data points from an increase in patients they will see, meaning they'll get a more accurate understanding of disease. Thus, they could better innovate off of this.
The impact. Medicare for All increases accessibility to reducing healthcare costs and increases the amount of doctors. 137 million people struggle with medical debt, which can be reduced with Medicare for All. Medicare for All can lift 8 million people out of poverty, and Medicare for All can save 68,000 lives annually. Thus, we believe Medicare for All is the best system of healthcare for the United States. Thank you.